Hi everyone, it's Elise. I'm just on here today doing my flashcard presentation for this week. I hope you guys enjoy. Okay. And all right, flashcard presentation for pelvic inflammatory disease by Elise Kleppner. Disease process. So PID, or pelvic inflammatory disease, is a sexually transmitted infection linked to infection. This means that the most common way that a person acquires this is through unprotected sex. But it can also occur if the bacteria that was already found in the vagina. PID is found in the ovaries, uterus, and fallopian tubes. It's a highly severe infection and only affects women. The way PID occurs when a particular bacteria spreads from the female's vagina and then travels to all of her reproductive organs. Cleveland Clinic 2023. The pathophysiology of it. There are quite a few types of bacteria that can cause PID, but the two most common are chlamydia and gonorrhea. Both of these bacteria are considered STIs. Of course, there are other ways that bacteria can cause PID. PID happens when the cervix is disrupted from doing its job to protect the reproductive organs. So this can occur when the female has just had a baby, if she has an abortion, if she is on her menstrual cycle, or if she has a miscarriage. And then lastly, PID can arise from having an implanted birth control placed. Mayo Clinic 2022. Risk factors. The biggest risk factor known is women who have unprotected sex with multiple partners. According to Johns Hopkins, the other risk factors for contracting PID are women under 25 who are sexually active, women of childbearing age, women who have IUDs within the first 3 weeks of it being implanted, and women who douche often. Johns Hopkins 2024, paragraph 3. Symptoms. Most of the time, the signs that a person can tell that they have this condition are either so mild that they may be unnoticeable, or they may be very light. So they might not go seek assistance like they should. According to Cleveland Clinic, these symptoms include pain or tenderness in the stomach or lower abdomen. Cleveland Clinic 2023, paragraph 5. Yellow-green vaginal discharge with a foul odor, fever and or chills, nausea and vomiting, painful intercourse, a burning sensation when you're urinating, and an irregular menstrual cycle. Cleveland Clinic 2023. Here, I just wanted to show you a picture of what PID looks like. So under the normal fallopian tube side, you can see that the tubules look perfectly fine. There's nothing swollen or abnormal looking, but on the inflamed fallopian tube, you can see that the tube is very, very noduled. It has many lumps. Also, the connective tissue that you see there is very, very stretched. And everything is just really swollen and inflamed. Diagnostics. There is not a specific test that is able to diagnose PID, but rather a group of tests that rule out other infections. The doctor can run a blood test, a pelvic and vaginal exam with a culture, a thorough physical health history, as well as how many partners the female has had in the past, so sexual history. Ultrasound of the abdomen and pelvic area. Urine cultures, and of course, STI tests. Cleveland Clinic 2023. And that is the end of my presentation, and here are my references. I hope you enjoyed. Thank you.